We have word tonight of a significant advance in treating a form of cancer that will strike 70,000 Americans this year. Dr. Jon LaPook tells us the results are so good, the FDA is putting the treatment on a fast track.
3 years ago, Thomas Sandoval was looking forward to the birth of his second child when he was diagnosed with a rare form of a blood cancer called lymphoma. Despite chemotherapy and a stem cell transplant, the cancer returned before his daughter's first birthday.
Everything's at stake. Thoughts in my head of not being around with for my daughter, my son, my wife. Yeah, it was a pretty tough time.
What really makes this time
Sandoval is alive today because of an experimental form of immunotherapy called CAR-T.
Normally, our immune cells are good at killing invaders like bacteria, but bad at fighting cancer. With CAR-T, a patient's own immune cells are removed from the body, reprogrammed to find and destroy cancer cells, then put back into the bloodstream.
Today, Moffitt Cancer Center and MD Anderson reported test results of 101 patients with advanced lymphoma who had failed previous therapy and were treated with CAR-T. Dr. Frederick Locke helped lead the trial.
It puts a GPS navigation on the front of the cell so that when they're infused back in, they know where to go and kill the lymphoma.
About 8 months after a single treatment, 39% of patients had no evidence of cancer.
That's actually quite remarkable, knowing that these patients, at best, only 1 out of 10 of these patients could have complete disappearance of their lymphoma with standard chemotherapy.
Side effects included flu-like symptoms and confusion. There were 3 treatment-related deaths. The FDA will review these results and could make a decision on approval, Scott, by the end of the year.
Great advance, Dr. Jon LaPook. Thanks, Doc.